Welcome back. I'm Dr. Ellen, the Midlife Whisperer, and so delighted to have you here on Rock Your Midlife, where we are sharing amazing tips and techniques from some of the leading experts on midlife and menopause. And today I am excited to be sharing with Dr. Carri Drzyzga. She is internationally known as the functional medicine doc. She is the go-to expert on finding the root causes of health problems so you can feel normal again, including she is a top expert on menopause and midlife and dealing with that midlife fatigue that we so often experience. She is also a certified gluten practitioner, and she also has her own radio show called the Functional Medicine Radio Show, and she is the author of the hit book, Reclaim Your Energy and Feel Normal Again, Fixing the Root Causes of Fatigue. Welcome to the show, Dr. Carri.
Hi, Ellen. Thanks so much for having me on. I'm so happy to be here today.
It's great to have you. And we talked a couple weeks ago, and you have some very interesting perspectives on how women can thrive in midlife. So I'm really excited to really dig into that. But first, I want you to share your own personal story of transformation in terms of your career.
Okay, so I'm happy to share that. So originally I trained as a chiropractor. And I graduated chiropractic school in 1995, and I started then into private practice. And honestly, within 5 years, I knew that that was not the career for me. I was not 100% fulfilled and satisfied. I felt like something was missing. And so I know a lot of your listeners and viewers probably have that same kind of feeling. And so at that point, I was just on kind of a journey trying to figure out, well, what do I want to be when I grow up? and I was just naturally kind of curious about health and wellness. And so I started taking lots of courses and doing lots of conferences, learning about nutrition, detoxification, allergies and sensitivities. And then I finally came across functional medicine, and I was like, okay, this makes sense. So functional medicine in a nutshell, I'd like to say, is find the cause, fix the cause, and feel normal again. And then I was trying to implement what I could, and I was being restricted by my scope of practice. And I ran into a naturopath, and I said, well, gee, what do naturopaths do? And I looked at their scope of practice. Now, mind you, this is 2008. And so I'm at this point like 15 years into practice, and I said, holy cow, that's what I want to do. I need to go back to school, get a naturopathic degree, get a naturopathic license so I can fully practice how I want to practice and how I want to help patients. So yeah, I was 15 years into practice. I moved from Ontario back to Chicago to go back to school. I was flying back and forth to maintain my private practice. I was burning the candle at both ends for a couple of years because that's the goal that I was looking for. And then once that was all said and done with, and I was graduated and I got my license, and I was, back in Ontario living and practicing, that's when the fatigue really hit me, the after effects. So it was, a lot of stress going through that time. And that's actually what ultimately prompted me to write the book, Reclaim Your Energy and Feel Normal Again, because there are so many facets when it comes to fatigue. But that's just a little bit about my background and how my midlife changed, but in a really good way.
Yeah, thank you for sharing that. It's so inspirational because I hear from women all the time, they're scared to change. And I'm like, midlife is such a great time because I knew myself, I studied economics, and I was in a corporate job, and I went back and became a dietitian and then a psychologist. And it's really a wonderful time to regroup, and you can do it. You can go back to school, you can remake yourself, and it sounds like you really have all the tools that you need. I love that you're a naturopath. Actually, I have a naturopath as my primary. I mean, here in Vermont, they let you do that, which is amazing because it's such a different way to think about medicine. I totally share that. The fatigue issue, I actually came down with Hashimoto's disease, and I went to conventional physicians because my gut wasn't working, and I went to a naturopath. He diagnosed me. I got off gluten. I changed my lifestyle to a large extent and feeling so much better. So let's dig into fatigue, because that's such a big midlife issue. Our bodies are changing. We're lacking sleep. What do you tell women who are in their 40s, 50s, and 60s who come to you and say, I'm just so exhausted and I don't know what to do?
So I guess first I tell them, I hear that a lot. That's pretty common, and that's actually not normal. I find a lot of times, and this is really through the information that I get from my patients, is that they feel they're not satisfied with how they're being treated in the healthcare system. Like they're not taken seriously. Well, you're just tired. It's not like you don't have cancer or anything. You're just tired. Like you just need a vacation or you need more sleep. And usually the patients are like, no, like there's something, I can feel there's something wrong. There's something going on. And so really what they want is they want answers. And I also tell them that fatigue can be a very complex issue. There's some basic areas, basic things that we want to start with. And I talk about that in the book. Like we want to make sure, do you have anemia or not? Do you have an underlying thyroid problem or not? And then one of the big things I like to say is, well, how well are you sleeping? Like, do you fall asleep okay? Do you stay asleep all night? Do you wake up feeling rested and rejuvenated? Or do you wake up feeling like you could use 4 more hours of sleep? And so when it comes to fatigue, fundamentally, I like to start with talking about sleep, because if you're not getting good sleep, you will not recover your energy. I mean, period.
Yeah, that's so important. So when people are having trouble sleeping, of course, women at midlife are, when we're having, night hot sweats, night flashes, hot flashes, night sweats, a lot of hormonal things going on. When sleep is the primary issue, what are some of your recommendations?
So I think a lot of women who are in their midlife don't necessarily realize that their sleep issue could simply be related to hormones. And by hormones, I'm particularly focused on progesterone and how progesterone helps with sleep. So in our midlife, that's when we're starting into perimenopause. And as our hormones are changing, the first hormone to drop is progesterone. And progesterone will start to drop usually in our late 30s, early 40s. And for some women, it's a slow decline. And for others, it's pretty sharp. Mm. And so for the listeners and viewers out there, some of the very common symptoms of progesterone deficiency or insufficiency have to do with, you can fall asleep okay, but you're not sleeping well through the night. You wake up multiple times during the night and can't fall back to sleep, or you're just not getting deep sleep. Maybe you're a light sleeper. Some other symptoms of progesterone deficiency or insufficiency, some women will feel it in their mood. They'll feel more irritable. They'll feel more on edge. They'll feel more easily overwhelmed by stress than they did years ago. And to remember that progesterone is the building block for cortisol. Mm-hmm. So if you are under a lot of stress, you're going to be using your progesterone up in order to make cortisol. And then other mood issues that can crop up with progesterone deficiency or insufficiency can be just feeling like worried, nervous, anxious. So anxiety is a very common classic symptom of progesterone deficiency. And then some of the other ways progesterone can manifest has to do with your cycles are changing. Cycles, the length, the timing, changing. Maybe your amount of bleeding is becoming a little bit lighter, a little bit heavier. Any kind of change in your cycle really has to do with progesterone. Those are the big ones. So sleep, mood, and then changes in the cycle, those all signal that it's likely that your progesterone levels are not where they used to be, and we would want to optimize those. And how do we do that? Well, we prescribe progesterone. And usually women sleep like a baby.
So when you talk about this, first, that's fascinating. I didn't actually realize that we're making cortisol from progesterone. And so, of course, that stress is, we're generating all of this cortisol, and that's eating up even more of the progesterone. I know for myself, when I was going through some things that, during perimenopause, my cortisol was skyrocketing in the evening. It was pretty normal, what it was supposed to be. And then it would start to peak in the evening, and I would find myself like I had just, felt like I had drunk a pot of coffee at 8, 9 o'clock where I'm trying to wind down. So when you say prescribe, tell me about, how do you figure out the levels? Because I know the levels fluctuate throughout the day. How do you prescribe it? Is it, a cream? Is it a pill? Is it over the counter? And I know it's a little different because you're in Canada, but how do we determine a level? And then what's the actual hormone replacement that you're recommending?
Okay, so these are all really great questions. And I would say for the viewers and the listeners out there, when it comes to hormones, this is the most confusing area of medicine and the area of medicine that has the most amount of misinformation. So when it comes to testing hormones, the gold standard is using blood testing. So specifically when we look at progesterone, we want to test progesterone on day 21 of the cycle. That window really is day 20 or 21 or 22 of the cycle. That's when progesterone should be at its peak. Day 1 being the first day of bleeding. So then you count out to day 21. That's when you go for your blood draw. That's when progesterone should be peaking. I know other doctors out there are using other methods to test progesterone, saliva testing, urine testing. The gold standard is blood work. And then when it comes to prescribing progesterone, so in Canada, where I am, progesterone is only available as a prescription. I know in the US, you do have over-the-counter options. So when we talk about progesterone, especially for sleep, you have to use oral progesterone. So progesterone cream is not going to work. Using progesterone drops sublingually is not going to work. You need an oral capsule. And that's because when you swallow down that progesterone, it gets absorbed out of the stomach and goes to the liver through first pass metabolism and becomes a metabolite called allopregnanolone. And it's that metabolite, allopregnanolone, that helps you sleep and can help with that feeling of nervous energy, anxiety, worry. That is what's proven in the research, and that's what works best for women.
And is it, and I know again it's different in Canada than the States, but and I know there's lots of viewers who are international. Is it a prescription medication, or is it, you said we can buy something over the counter? So where would someone go? But it sounds like they really need to get tested first to know what that level is.
So yeah, ideally you want to get tested, and then I can really only speak for Canada. It's available by prescription only, by a medical doctor, by a naturopathic doctor, by a nurse practitioner. I know in the US you have some progesterone available over the counter as a cream. Again, that's not going to work. And you have options of progesterone liquids. Again, that's not likely going to work. What you probably need is to consult with some kind of a doctor that is able to prescribe. And that's really going to vary from state to state because every state has different laws and who can prescribe, if it has to be a medical doctor or a naturopathic doctor or even chiropractors in some states can prescribe.
Really good information. It's so great that you're letting people know, because we'd also talked about not everyone is pro hormones, but it really sounds like if you're low on it, replacing it really is the smart way to go, and getting that diagnosed, getting your progesterone levels diagnosed. What are some of the other issues that you see around fatigue besides the hormones fluctuation, which is causing the sleep problem? What are some of the bigger other causes of fatigue?
So if we focus a little bit longer on sleep, the other thing is, as we get older, the hormone melatonin starts to reduce. So the older we get, the more melatonin comes down. And of course, melatonin is one hormone that we kind of naturally always associate with sleep. And probably, your viewers, your listeners, they might have already tried melatonin. Most people have. And most people say like, well, it didn't really help me sleep, Dr. Carri. I said, okay, well, let me explain why. So here's why. So melatonin can help you fall asleep, but it won't help you stay asleep. And so that's because melatonin has a very short half-life of 2 hours. So that means after you swallow your melatonin, 2 hours later, half of it has already been metabolized out of your body.
So but is it enough? Can you stay asleep even when your natural levels come up?
No. And so one of the things that I've helped patients with, so we work with progesterone and we say, okay, does that help you sleep? It usually does. And some people need extra help with melatonin. And so what I recommend is that they use a delayed release or a time release formula, and they just dose it up until they are getting really great sleep at night, and they maintain whatever level that is for them.
Well, that's a great idea. Now, I had heard from certain people that also you can your body gets used to the melatonin after a while and you're not able to produce it naturally. Is that correct?
So there's no evidence in the research of any of that being true.
Oh, that's good to know. So, and it's, you can get time-release melatonin over the counter relatively easily. Oh, that's great.
I
That's,
don't know. I don't know how relatively easy it is,
okay.
but it is available over the counter.
Oh, that's good to know because I know I've taken melatonin and it generally helps me fall asleep right away. So I find it is actually a good hormone to take. And I know it also has some other health benefits along with just helping you sleep.
Yeah, so melatonin is a really powerful antioxidant and anti-inflammatory in the body. And so, like I said, when it comes to women that have fatigue, the first thing we want to say is, are you sleeping well at night? No, I'm not, Dr. Carri. Let's get you sleeping better. Here are the two options that we can start with. Which one do you want to start with?
Yeah, that's great advice. And there's so many other things you can do with sleep too. I often, as a health coach,
Yeah.
talk to people about sleep hygiene. So things like turn the media off. We know that there's a lot of craziness and chaos in the world. Turn your email off, turn your phone off at least an hour before you go to sleep. Don't watch any stimulating, violent kind of TV. Really just read a book, meditate, put your lights lower, don't eat later in the day, watch out for alcohol. And I think also if you're going through, perimenopause, also don't eat spicy foods if you're having hot flashes. So there is so much that women can do. So besides the sleep, and I think you've really addressed it. Thank you. I've got some great new information myself. What are some other causes of fatigue and how do you treat that besides the sort of the sleep and the hormonal issues?
So I think the other big cause of fatigue that actually most doctors don't know about because they haven't been taught it is neuroinflammation or an inflamed brain. So there is a chiropractor out there, Dr. Datis Karazian. He is, I think, the top notch of functional medicine doctors out there. And he had a conference last year all on neuroinflammation. And of course, I went to that because I'm always looking for new information. Okay, how are things changing out there and how can I help patients? And so he said, that your brain is inflamed you're tired, you feel brain fog. Remember those words that you need to get out of your mouth, or you forget where you put your keys. These are all very common symptoms of brain inflammation.
It sounds like
So I know there's a lot of doctors and a lot of practitioners out there who talk about fatigue with cortisol, with the adrenals, with thyroid, with the other. Go ahead, say that again.
Oh, I was going to say, no, it just sounds like so many women I talk to at midlife are just that sense like total brain, brain fart. Like my brain just stopped. You can't remember somebody's name. You sort of forget, like you said, forget where you put things. It's so common at midlife. And I've never heard of this idea about neural inflammation.
Yeah, so the brain can actually be inflamed. Now, there's no way to measure brain inflammation. Like we can't stick a syringe in the brain, suck out a bunch of juice and measure that. That test is not available yet. And so all of this information, it's in the research. And of course, the research on brain health for the last 20 years has just exploded. But this information has not trickled up into a clinical setting yet. So one of the things that I think about above and beyond all of the typical kind of usual causes of fatigue is, does that patient in front of me, is it possible that they have brain inflammation? Is their issue really a brain problem, or is it a hormone problem, or is it a gut problem, or is it, that's how it is in functional medicine, find the cause.
Right.
And so you might have brain inflammation if in your history you've ever had any head trauma, concussion, slip and fall on the ice, or hit in the head by something. If you have had any trauma to your head, that makes me more suspicious that there might be brain inflammation going on. If you've had any significant emotional trauma to the level of being diagnosed with PTSD, significant emotional trauma like that can inflame the brain as well. So it doesn't have to necessarily be a physical trauma. It can be an emotional trauma. And then, of course, underlying infections can inflame the brain. One of the biggest ones being from the gut. So I'm sure you've had other practitioners on the summit talking about gut health, likely. And so we know more and more about the microbiome these days, but When it comes to fatigue, one of the things that I like to check for is LPS, or lipopolysaccharides. So LPS, or lipopolysaccharides, these are gram-negative bacteria that are found in the bloodstream. So fragments of these bacteria found in the bloodstream. They are highly, highly inflammatory to the brain.
Interesting. So, and what could, can you take probiotics, certain, fermented foods? What would you do to shift that gut flora?
So when I see, so that test that I do to find LPS, that's by Cyrex Labs, which is a very much a specialty lab. It's their Array 2 to test for leaky gut. Most patients, I don't really care if they have a leaky gut or not. I just assume they probably do, but I do care if they have LPS, because that puts a whole new level of complexity into the case.
Absolutely.
And so if we do find this bacteria, then the next step is, okay, where is that coming from? It's likely either coming from the small intestine or the large intestine. The small intestine being SIBO, small intestinal bacterial overgrowth. So too much bacteria in the small intestine, where normally there should be 0 to none, So it's either coming from there or the large intestine. So I like, if that LPS test comes back abnormal, I like to follow that up with a SIBO breath test. Because if then the patient also has an issue in their small intestine, now that brings another level of complexity to the case, because that's not easy to fix as compared to dysbiosis in the large intestine. So some of that we want to follow up and get a little bit more clarity of, okay, where is the problem? We know there's a problem. Where is it exactly? And then all of the different treatment options, which have to do with diet and lifestyle and different targeted supplements to try and manage the bacterial load, and then to try and create and attract probiotics and prebiotics back into the area to try and get everything healthier for the long term. So just using probiotics by themselves can be, it will only get you so far. It really has to be a well-rounded approach that includes a diet component.
Yeah, that makes a lot of sense, to figure out what the bacteria, the offensive bacteria is, and then to do the SIBO test on top of that. I found in my area, people aren't doing that testing. It's hard to actually find someone, even in Vermont, which is kind of a more liberal place as far as healthcare is concerned. It's hard to find that test. That's great information. So besides doing the gut testing, if you're finding someone has had a concussion or they've had PTSD, what can you do to treat that if that's really the cause of fatigue, as opposed to the gut issues, which are a combination of, sounds like, taking certain herbs to get rid of the offensive bacteria, taking certain supplements, probiotics, fermented foods, things that are going to feed the healthy bacteria. But if it's the PTSD or a concussion, what can someone do if they, have this neural inflammation?
So there are some basic things that we want to do. So if we think about diet, the most anti-inflammatory diet from a neurological perspective is a ketogenic diet. And we're talking about a healthy, clean ketogenic diet, not one that you're eating bacon and cheese all the time.
Pork rinds.
That's actually going to inflame you more. So it's a mainly plant-based, healthy, clean ketogenic diet. There's a lot of firm research on the benefits of that. So that's not, just like a fad diet. That was actually put together for neurological issues.
Yeah, that's a great suggestion.
So there's the diet component, and then lifestyle components. Making sure that the patient is getting good sleep, that's vital. Stress management, vital. There can be a component of watching and monitoring and manipulating exposures to electromagnetic fields, because that can have an impact on brain inflammation for some patients. And then there are targeted supplements that can be used to try and calm down that brain inflammation.
Well, amazing information. So just to recap everything. So the first thing is look for hormones. So if you're listening, you're experiencing fatigue, which is really a problem. I think it's also, at midlife, we've got so much influence because we're actually in touch with 3 generations. So we've got our, the younger generation, our kids, our children, our own generation, and then the older generation. So we have this opportunity to have a huge impact. But because we're doing so much and our bodies are slowing down a little bit and we're going through that change, fatigue is really common. So it sounds like the first thing is to get to a naturopath, and we'll also give your information out because I know you've got fantastic resources for folks. Get tested on that 21 days, find out where your hormone balance is, see if you can get a progesterone supplement that you take orally to help balance that out so that you can actually get some decent sleep. And then the next level would be really looking at your lifestyle, looking if you have some kind of neural inflammation. And overall, again, of course, total lifestyle. So making sure that you're exercising, making sure that you're taking care of your stress, and eating a healthy diet. So not eating any processed foods, eating plenty of fruits and vegetables. As you said, I don't always like the word clean, but more organic, less processed, more natural foods. There's so much you can do. And so I know I'm a big proponent of just saying, just because I'm going through that time, because I'm going through menopause, I'm going to feel like crap. That's not the reality. There are so many things that you can do about it, as Dr. Carri has said. So thank you for all your generous sharing of information. Can you please tell us about, I know you've got some great free gifts. You've got a awesome detailed video and some books and resources. Tell us how we can get in touch with you and the great resources that you have for listeners.
So probably the best way to get in touch with me, I have two websites. So there's functionalmedicineontario.com, and my other website is drcarri.com, spelled DRCARRI. And of course, you had mentioned my podcast, the Functional Medicine Radio Show. That's available online. And so my free gift to your subscribers to the summit is a copy of my book, Reclaim Your Energy and Feel Normal Again, Fixing the Root Cause of Your Fatigue with Natural Treatments. So in that book, I outline 8 causes of fatigue, even though there's like 20 causes of fatigue. I outlined 8 in that book. That's all there's really room for. And I know that you're going to give the listeners, the viewers, the link so that they can get a copy of that book.
Right. That'll all be in the show notes. And thank you. That's very generous of you. And again, if you're listening, if you're going through fatigue, it's not something that you have to go through. There is so much that you can do starting today. So Dr. Carri, thank you so much. I have learned a ton. I'm going to go get some of that time-released melatonin and start applying that immediately. Thank you all for listening. I'm Dr. Ellen, the Midlife Whisperer. Please stay tuned tomorrow for another wonderful interview to help you rock your midlife. Have a beautiful day.